So I guess my presentation will not be such spectacular as technical presentations before. But as you and Ricardo says at the beginning of the workshop, this last year for we the IT professional who work in healthcare environment and healthcare sector, it was a pretty, let's say, complicated times, because we face suddenly some kind of troubles working from remote locations from one of our doctors and staff. We suddenly need to put together remote patient care, remote monitoring for the patients, and in the infrastructure in our hospitals, we have many systems we need to be monitoring, let's say, starting from, I don't know, medical devices like MRIs, CTs, ultrasounds, through the monitors. We have systems who monitor our network infrastructure, our BMS. We have a lot of system with every system with his own interface. That's why I think it's very important from our perspective, from our end user perspective, to have one solutions to monitor all these systems and to have a centralized dashboards, as you mentioned before, to be more precise in our operation, day-by-day operation. To start a little bit with how we managed to come up with these requirements for the SPHINX toolkit. We start with a workshop, and we put together all the our experience in IT field, or all the partners from the SPHINX Consortium. We have results from a workshop we conduct in the Brussels in 2019, and we saw there that it is very important to have users with cyber awareness capabilities, let's say, and to have more centralized, as I said before, solutions for the monitoring our networks. In order to achieve these requirements for the SPHINX toolkit for the health domain, we use a Volere methodology in order to categorize the requirements that we gather from all our partners. These requirements are based on the user know-how and experience, and are the guidelines for the technical partners. We categorize the requirements in 4 categories: IT hardware, networking, application, and security, privacy. And more, we use the cybersecurity management cycle to have 5 subcategories: identify, protect, detect, respond, and recover. In the next slides, we will see some example of functional requirements. We came up with a total of 85 SPHINX requirements, functional and non-functional requirements. And these requirements were the starting block for building a SPHINX system. As we saw in the previous presentation, the very important aspect of SPHINX, its interactive dashboard, because this is the way we end users interact with SPHINX ecosystem. That's why for us it is very important to have, as I said, as I already mentioned before a few times, a centralized system in which we can access various components of the SPHINX ecosystem, even if we speak with data monitoring, with anomaly detection, data traffic, and so on. It is very important for us also to have alerts and to be aware when and where an attack or I don't know, malicious actions occur. And we think with this SPHINX toolkit, for us IT experts will be easy to maintain and operate our networks, even if we speak of a computer network, when we speak about medical devices, when we speak about IoT devices, because the footprint of the computer and IT services in the healthcare sector, it's increasing year by year. Sorry, I have a little bit of, I was a little bit nervous, sorry, and this was my presentation.